More promising news on the race for a COVID-19 vaccine. Oxford University says the vaccine is developing with AstraZeneca is safe and creates an immune response in elderly and younger adults. As Sarah Harmon tells us, they hope to report results from late-stage trials by Christmas.
It's been an encouraging week in vaccine research, and this morning there was more good news out of the UK. AstraZeneca and Oxford University publishing the results of their phase 2 trial in the medical journal The Lancet. They found that the vaccine they're working on is well tolerated in older adults and it provokes an immune response.
So our results show that adults over the age of 70 have as good antibody responses as adults aged 18 to 55.
That's important because older adults are more at risk for severe forms of COVID-19, and they're also the more difficult group to create an effective vaccine for.
What we need to do next is to see whether or not this translates into actual protection from infections.
To find that out, we'll have to wait for the end of the phase 3 trials, but we did get some encouraging news earlier this week from other drug makers, Moderna and Pfizer, both announcing high efficacy rates for their vaccines in the early stage 3 trialing process. This morning's good news, a little bit of light at the end of the tunnel for all of us.
Some more good news for pregnant women that have or are currently fighting COVID-19. New research says the coronavirus is not linked to adverse outcomes for mom and baby. The University of Texas Southwestern Medical Center tracked over 3,000 pregnant women, 250 of them who had the disease. The infected women had similar rates of preterm birth, preeclampsia, and C-sections as those who did not. 3% of infants tested positive. Most were born to women with mild or no symptoms.